everyone. My name's April Demito. I am a professor here at Olivet Nazarene University, and I am going to touch base on some of the key components of Chapter 26, Sexually Transmitted Infections. This doesn't by all means encompass all of the material in the chapter, but we're going to go over the highlights. The first piece we're going to cover is bacterial infections, and these are 8 of the most common bacterial infections that you're going to find in this population. We'll start with gonorrhea. Gonorrhea is an infectious disease process, so it affects both men and women. We worry about gonorrhea for many reasons, primarily due to its risk of causing infertility. It can cause pelvic inflammatory disease, and also if the mother is active with gonorrhea during the birth process, it can cause blindness in the newborn. This is one of the reasons that an antibiotic ointment is put in the newborn's eyes at birth. The big problem with this is gonorrhea is becoming resistant to a lot of the antibiotics out there. So another reason why we need to be diligent with antibiotic stewardship. Syphilis is another bacterial infection. There are 4 different stages of syphilis, and this is a big one because it can be transmitted to the baby in utero and cause CNS issues, intrauterine growth restriction, and it's treated best with penicillin. I had a interesting case I'll tell you about. When I used to be a labor and delivery nurse, and we had a patient that was positive for syphilis. She was, I can't remember how far along she was in her pregnancy. I want to say 20 weeks or so. She was very allergic to penicillin. So we actually had to admit her to the intensive care unit and desensitize her to penicillin and then administer the penicillin while she was in the intensive care unit. And it did work, but it was quite a process. Chancroid is another bacterial infection. Women are often asymptomatic with this. Men may develop ulcerations on the penis, and this is not something that's incredibly common in this country, but we do see it. Granuloma inguinale is another one. This is, again, not common in the United States. This is more often seen in other countries and treated with antibiotics. Bacterial vaginosis is one I wanted to spend a little bit of time on because it's in the chapter of sexually transmitted infections, but it's not always transmitted sexually. Bacterial vaginosis is an infection that can occur in the female just if the conditions are correct. So it's caused by an anaerobic bacteria. And this is the patient that presents with that typical fishy odor. And on a slide under a microscope, you'll be able to visualize clue cells. And it's treated with flagyl. But it can be transmitted sexually, but it could also be something that is acquired by wearing pantyhose in a hot day or wearing a swimming suit on a hot day that's wet and damp. So there are other ways that women can acquire BV. Chlamydia is the most common sexually transmitted bacterial infection in the United States. And this is something that needs to be treated. Both men and women need to be treated. This is typically treated with azithromycin and 1 gram on a one-time dose, and that's all you need to do to treat that. I'm just looking over at my notes to make sure that I'm not missing anything. And the big problem with many of these bacterial infections are like chlamydia is asymptomatic. So it can have some long-term effects if it goes on for too long. So it can also contribute to pelvic inflammatory disease. So patients who are at high risk need to be tested on a regular basis. Lymphogranuloma, venereal is another one that is not super common in the United States. And this is typically characterized by a swelling in the lymph nodes You're going to see that in the groin area. This is going to be seen most commonly in the male. You can actually have draining ulcers with this one as well. Non-gonococcal urethritis is a inflammation of the urethra in men that is not related to gonorrhea. So that's why it says non-gonococcal. So this could be caused, it is caused by a bacteria, but not the not gonorrhea bacteria. Viral infections, and these are the three main. Genital herpes, and if you may remember, genital herpes typically is HSV1 and HSV2. We think of genital herpes as being HSV2, with the oral type being type 1. However, you can get type 1 in the genital area, and you can get type 2 around the mouth too. All has to do with sexual practices. Now, genital herpes, typically, the patient will go through periods of being asymptomatic, and then they will begin to develop a burning, stinging, tingling sensation, which is the precursor to a breakout. And they are contagious during that period. So, and unfortunately, they are contagious for 24 to 48 hours prior to that sensation. So it's very, very important to practice safe sex if you have genital herpes, because you can pass that on to someone else, even if you are symptomatic. Now, if you do get herpes, the first outbreak typically occurs about 2 weeks after contact. It can happen a little sooner, 10 days to 2 weeks, and that first outbreak is the worst. Patients who get the first outbreak get a fever, swollen lymph nodes. They feel sick. They feel like they have the flu. And when the lesions come out, they're incredibly painful. The only way to test this is to do a viral swab. But if a patient were to come in presenting with the symptoms, you're going to go ahead and treat. The treatment is Valtrex, and 1 gram 3 times a day for 7 days. And genital herpes can be very dangerous to the newborn. So women who are pregnant who have a history of genital herpes need to be under very close observation, especially when it comes closer to delivering the baby, because we don't want the mother to deliver with an active case of herpes vaginally, because if that's passed on to the baby, it can cause death. So many women are actually treated with Valtrex in the 3rd trimester as a preventative measure, and then in labor, their genital area is examined very extensively to ensure they don't have any lesions. Human papillomavirus, or HPV, is the most common cause of cervical cancer in the United States, and women are typically tested for HPV when they have their pap smear done. There's a vaccine out now. It's called Gardasil, and it doesn't cover all strains of the virus, because there are actually over 40 different strains of virus, but it does cover the ones that are most common for the development of cervical cancers. And this is recommended that all children be immunized between the ages of 9 and 11, both boys and girls. Molluscum contagiosum. Molluscum is a virus, and it's odd when I first saw this in the chapter, because I see this more in the pediatric population. I had not associated it with a sexually transmitted infection. However, it is a virus, and it is transmitted by close contact, and it's self-limiting. It goes away on its own. It causes these little vesicles, and these vesicles can hang around for weeks, and there's not a lot you can do for them. If they are troublesome, you can go to the dermatologist and have them removed, but you may develop other ones, so it just needs to run its course. All right, let's see. Parasitic infections, Trichomonas scabies and pediculosis pubis are the most common. Trichomoniasis is a parasitic infection, and you'll see this in both men and women. And intense itching is one of the primary symptoms of this, and with a strong odor. This is treated with flagell. Scabies is a parasite. This parasite bores underneath the skin, and it's very interesting if you have an opportunity to get on Google and Google scabies, what it looks like, because sometimes it's difficult to diagnose. You'll typically see these lesions on the webs of the fingers, or and they're linear because this little parasite burrows underneath the skin and then travels. So the treatment for this is to use a anti-parasitic ointment. They do sell stuff over the counter that you can try. If it's not effective, then you're going to want to go to your primary care provider and get treatment. And pediculus pubis, or the common term for it is crabs, is lice in the pubic area, and it's treated the same way. You can buy an over-the-counter lice medication and use that. And it's not always contracted by sexual contact. Scabies isn't either. It just increases the risk. You can develop sexually transmitted infections of other body systems is hepatitis B and acquired immunodeficiency syndrome. So hepatitis B is transmitted through blood and body secretions, and people who are at high risk should be screened for that if they have not received the vaccination. Most people in this country receive the vaccination as an infant now. When it was my age, when I was born, they didn't do that, but they do it routinely now. And then there's acquired immunodeficiency syndrome, or HIV, and this is, again, a sexually transmitted infection. You can also get this through the sharing of bodily fluids. And the treatments for HIV have come so far now that patients consider it more of a chronic disease than anything else. It used to be, when it was first discovered in the early 80s, the span of life was very short, and it's quite expanded now because of the advances in medicine. So this gives you a thumbnail sketch of the information in this chapter, and I hope that this helps to clarify some things, and have a great day.